The International Committee of the Red Cross, ICRC, has voiced deep and shocked concerns after the killing of 8 people in Gabole village near Balad district in Hirshabelle region. Amongst those killed, 7 are said to be healthcare workers working at a local health center. The ICRC head of the Somali delegation, while speaking to CBA, strongly condemned the violence against health personnel. Jag Yaglin has called upon different players to promote respect for health workers.
We are appalled by this brutal attack on health workers in a clearly identified structure that was serving Somali people. We as the ICRC, we strive for many years now for more respect of the health mission. The health mission in a country like Somalia, where there's a conflict, is protected by the international humanitarian law, and we call upon everybody to respect those basic services that are meant for people who are mostly in need, who are often civilians, and who have often no other means to get the service.
The International Committee of the Red Cross also says this recent tragedy will grossly affect the gains made in the health sector.
Indeed, that just enhances those difficult times we are all in, and especially our colleagues in the health sectors. They have taken risk the last few weeks, going out there, helping people, treating people. They have taken risk in regard to the pandemic, in regards to other calamities that affect Somalia. And we know violence is reoccurring in Somalia, but such a brutal and appalling act is really giving a knock to health workers across Somalia. And it is really a setback. We hope we'll overcome, and we also hope justice will be done in this case.
Healthcare facilities in Somalia are often hard to reach for much of the population. Only 15% of the people living in rural areas are estimated to have access to medical care, a challenge often further complicated by outbreaks of violence or climate shocks such as floods. ICRC now says health personnel, medical facilities and transport such as ambulances must be respected and protected in all circumstances, and the work of medical personnel must be facilitated at all times. Violence against health workers, it said, jeopardizes access to health services and much-needed assistance for the people in need.
Specifically for that health center, this is devastating. There were staff, and these are not big structures, so losing 7 colleagues is also emotionally a big blow, and also for the structure as such to continue functioning. For the broader context in Somalia, in the health sector, this is raising fears and worries for many, for organizations like ours. Are we safe? Can we work? Can we operate? Are we respected? This is putting questions once again. And also our colleagues, our frontline workers who go to those centers and take risks by working every day, they are, of course, in a state of fear, and that's definitely not helpful for a good service to be provided to the people.
It was not immediately clear who was responsible for the killing, which followed several days of clashes between security forces and insurgents belonging to the Al-Qaeda affiliate Al-Shabaab. Since 2008, Al-Shabaab has been fighting to overthrow Somalia's central government and establish its own rule based on its own Sharia interpretation of Islam. Somalia has been mired in conflict since 1991, when clan warlords overthrew dictator Siad Barre and then turned on each other. Eunice Deco, CBA News.